As mental health professionals, how do we treat people with schizophrenia? How do we help them to our best ability? Well, that is the question we'll be addressing today with our two special guests, Kody Green and Carlos Larari, like Ferrari. Our special guests today will be talking about how we can address schizophrenia from both a personal and professional perspective. Kody is someone who has struggled with schizophrenia himself and has become a motivational speaker, has over 1 million followers on TikTok, and will be speaking from his personal experience and is an advocate himself. And we're also joined by a nurse practitioner, Carlos, who is double board certified as a nurse practitioner in both family medicine and psychiatric mental health, as well as he's a law student, and he also holds a master's in business administration. So we'll be joining with them today. They're going to talk from their personal experience about how we can best guide those with schizophrenia. And I'm so excited to be covering this topic for the first time. So without further ado, Carlos, Kody, welcome to the Mental Health Toolbox.
Yeah, thank you so much for having us, Patrick.
My pleasure. Excellent. This is going to be fun. And I've heard it said there's roughly about 2.8 million people who struggle with schizophrenia in the United States at any given point. Is that right?
That's right. And it affects about 1% of the population, give or take. And maybe it's helpful to backpedal here so people can get a little bit more context about what schizophrenia is. You know, we know schizophrenia is a complex chronic condition, a serious mental illness. It's characterized by distortions in people's thoughts, perceptions, emotions, language, behavior that can interrupt everything from personal relationships to career aspirations. And although, you know, the exact causes of schizophrenia are largely unknown, we know it's a combination of genetic and environmental factors. And the important thing to take away is it's not anyone's fault as a result of something they did or did not do that caused this condition.
Absolutely. Thank you so much for touching on that, because as mental health professionals, we know what schizophrenia is, but for those who aren't familiar with the mental health world, schizophrenia can come in different shapes and sizes, as we know, right? And that could be could struggle with more paranoia. You can struggle with more hallucinations. You can be more disorganized. That could be negative symptoms, positive symptoms. And so it's not a one size fits all, much like any other condition, really. We don't want to lump it into just one category, right? Like anxiety or depression. We're talking about humans and the human experience, and how, it gets messy. And so I'm so excited to have the both of you on, because you both have personal experience with schizophrenia. Right. Personal diagnoses. Yes.
Yep.
Right. And you have not let that rob you of quality of life. You found a way to thrive despite the diagnosis. And so that is really the power of this podcast, is learning from people such as yourselves who have found a way to thrive. And so thank you for taking time to share that today. Absolutely. So, Kody, maybe we can start with you. You want to share a little bit about your experience and how you have learned to leverage such a platform around raising awareness? We know you have over 1 million followers on TikTok, content creator, motivational speaker. Like, how did you get into this work, and what did that look like for you coming from a diagnosis like schizophrenia? That's hard enough to do without any hardships.
Well,
right?
For sure. And my journey with schizophrenia actually started with my mother. So I was a caregiver for my mother, who has schizoaffective disorder. So years before I ever got a diagnosis or even struggled with symptoms, schizophrenia was already a big part of my life. When I went off to college, my mom was finally doing well, had a proper diagnosis, medication, and it was my first year of college that I started having episodes of psychosis, and I suffered a psychotic break. I started having auditory and visual hallucinations, as well as paranoia and delusions. And so I always say that I don't think anyone plans on being a mental health advocate. I think it's, something that is really a person making the best of a situation. And that's kind of what I did. And from the perspective of being a caregiver and a patient, I thought I could really help people better understand schizophrenia, help people see, the misconceptions surrounding it. And so when I started doing advocacy and I started posting videos online, I didn't really anticipate for it to reach as many people as it has. But it really showed me that, one, a lot of people were interested in learning more about schizophrenia, but two, that there were a lot of misunderstandings or misconceptions about mental illness and schizophrenia. And so I'm just really lucky to be able to work with people like Carlos and other schizophrenia advocates to help try to correct some of these things that people think they know about the illness that I live with.
I love how you phrase that, what people think they know.
Yeah.
Right. And the longer I've been a mental health practitioner for 13 years, and the longer I'm in this work, the more I realize I don't know, right? There's so much to learn. There's so much we don't know. And so much of it is just a messy science, right? I think about mental health as kind of like where it's part science, but it's also very much art. And, trying to figure out how do we work on people puzzles despite the things we don't know, and how do we help guide others and empower others to live their best lives with the tools at hand, right? And it's a messy science, right? Whether we're talking about medication or anything else, it's tricky. It's tricky. Yeah. So absolutely love the work you're doing. I just want to kind of put your channel on blast here for a minute. This is your TikTok, right?
Yeah.
Kody?
Yep.
That's fantastic. So wonderful. And I see you're doing well there. Over 1.3 million followers, 42.6 million likes. And the big thing about that is that means you're raising awareness, right?
Yeah.
There are people out there who want to know how to thrive, right? With these conditions.
Over all of my pages, I have over 1 billion views on my pages combined. So to me, that really started showing this not only allowed me to reach new people, but it was allowing me to reach patients living with schizophrenia, friends and family members, and then, doctors, psychiatrists. I got to reach people that I always wanted to be able to, help better understand what schizophrenia looks like.
Yeah, because a stigma, right? Just like anything else, people will come to their own conclusions about what the media has told us something is. And it's much better to understand it from somebody's lived experience and to really be curious and seek that psychoeducation, and as opposed to make assumptions, right?
Yeah, absolutely.
So that's why I love the work you're doing. And I believe in tools up front on this podcast. So that's why I always like to share these on the front end. This is your website, right? Kody Green, Kody with a K. .com. Yep. This is where people can learn more about all the work you're doing there. Excellent.
Yeah, and there's some of the things not featured on my website are the Unseen and Unheard podcast, and that's also that also lives on the hopeforschizophrenia.com website, and that's a really great resource for anyone who is looking for more information about schizophrenia as well.
I'll make sure I tie all that up into the show notes, of course. And this is it, hopeforschizophrenia.com.
Yep. So there's a bunch of resources on here, but if you go to Real Stories and Understanding Schizophrenia, there will be the Unseen and Unheard podcast, as well as more information about what schizophrenia really looks like, some of the symptoms, just a lot of information for people that might not know a lot about the illness.
How fantastic. This is beautiful what you've put together here. It's so clearly organized. It's got a nice user interface. I can tell you this is your passion project. This is your baby, right?
Not my website. So it's just just one that the podcast lives on, and that's with a partnership that I have with Johnson & Johnson. They actually created this website as a resource.
What a great backing to have.
Yeah, absolutely.
It's wonderful. Yeah, you're big time. All right. Good stuff. And Carlos, this is your LinkedIn, right?
That's right. Yep.
I'm sure we look into that so everybody can see the work you're doing there. You've been busy, like we were talking about. I know you like to stay busy. And I'm going to guess it has something to do with your coping mechanisms too, keeping yourself challenged.
Yep.
Yeah,
absolutely right. Yeah.
absolutely. Do you want to share a little bit about how you got into this work of mental health and being an advocate for schizophrenia as well as a practitioner?
That's right. That's right. Sure. Well, like Kody, it was kind of a family affair for me as well, except it had, given that I come from a Hispanic and background and Latino culture, it wasn't often talked about, so I didn't really have an awareness of the kind of family history I had of people with mental health issues until I got diagnosed. But then kind of is when the stories came out that, oh, you had an aunt or family member that struggled, and back home in Cuba, for example, they had to get hospitalized or get care and things like that. So, and which speaks again to this kind of genetic basis for this illness and its tendency to run in families. But, and for me, I always loved being a student. I always excelled at school. So like Kody, I went off to college, and as often is the case for many adolescents and young adult, that often coincides with a period of vulnerability for mental health conditions. And for me, I started to have symptoms at college that interfered with my ability to achieve my academic and professional goals. Fortunately, I had a family friend who I had known for a long time who told my mom what's happening, and she came to campus, and we met with my academic advisor. And there we were able to start having a conversation about the mental health challenges I was having on campus, which kind of speaks to the importance of having a community of support. Often when you're struggling with these conditions, it's not the type of illness that you can just kind of pick yourselves up by the bootstraps. You need people to step up and advocate for you and care for you when you're your most vulnerable. So fortunately, I had that immense, community support of friends and families, and was able to get an early intervention in the form of a diagnosis and access to medication. And with that, I was able to empower myself, learn about the illness, learn about the risk factors, learn about the protective factors, so forth. And I decided I wanted to give back. I wanted to help people, particularly people that were going through or would go through what I went through. So I became a clinician. I became a psychiatric nurse practitioner. And from there, I worked in the field as a mental health professional for a number of years. But recently, I graduated law and policy school with the aspiration of having a kind of a greater impact and achieving more of a systemic change by advocating for mental health policy. I'm somewhat envious of Kody's impact, reaching over a billion, millions of people and over 1 billion views. I mean, that's incredible, and hopefully one day
Epic.
I can achieve something of that sort. But for now, I'm happy, studying for the bar exam, as you mentioned, and continuing with my professional goals. But the important thing to take away is that even with this illness, it's still possible to, find a way to move forward and pursue goals and give yourself a meaningful opportunity of recovery. I think, early intervention plays a big part of that. Community support plays a big part of that, and peer support. Part of what we do, Kody and myself, at the end of the day, is we're peers. We share our story to inspire others, to provide education, to provide resources, and to advocate for this population. So that's a little bit about my story, and I'm just grateful for the opportunity to have the platform of this podcast to say so. Thank you.
Yeah, I appreciate it. Wouldn't be here without you guys. So appreciate it. And you touched on something important there. You said early intervention, right? How important is it? Because as a therapist, and correct me if I'm wrong, but schizophrenia usually will manifest between the ages of 18 and 24, give or take, is oftentimes why you see it in college age youth, if the first episode, right? First psychotic break, as it's sometimes called. How imperative is it to have an early intervention? What happens if we don't get the treatment in a timely fashion at the first sign of trouble?
Well, I certainly know the impact it's had on my life as far as allowing me an opportunity of recovery as a patient advocate, but also as a clinician. We know that the duration of untreated psychosis increases the risk of a more difficult course of illness, and so just like any other illness, if you've recently had a heart attack, and in that field they say time is muscle. If you've had a brain attack, time is brain matter. It's quite possibly could be that the longer you go untreated with psychosis, the harder it will be to recover, and the harder it will be to achieve the goals that you want in your life. So early intervention is absolutely critical, as is the case with many other illnesses. Unfortunately, we have a long way to go there, but at least now we're appreciating just how important it is.
Yeah, absolutely. Well said. And I remember being at a seminar when they were talking about bipolar disorder and mania, and they were talking about how important it is to prevent as many future manic episodes as possible, because with every episode, it's more difficult to return to baseline. Right.
That's
I
right.
forget the technical term for that. I don't know if it's neurodegenerative or.
It's quite possible that for some people that this illness takes that kind of course, and that's partly because people aren't getting the early intervention or being able to be on a medication regimen with consistency. One metaphor I've heard is it's kind of like a rubber band. The more you have these episodes and the more you stretch out the rubber band, it kind of loses its elasticity. Well, it's kind of true for the brain's cognitive reserves, if you will. The more episodes you have, the more it might have residual effects that'll affect your functioning and so forth.
Yeah, makes sense. That's a great analogy for it. Absolutely. And so I'm wondering, what is that experience like? So for gentlemen such as yourselves who have experienced firsthand what schizophrenia looks and feels like, maybe Kody, you could start with you. What was it like living that experience with the onset? I mean, I can imagine it must be terrifying.
It's terrifying looking back, but there's such a level of delusion with schizophrenia that whilst in it, I didn't recognize how bad it was. The people around me certainly did, but because of how delusional I was, I didn't even think anything was wrong with me. At one point, I was having delusions that, this wasn't an illness. It was actually me gaining the ability to hear the thoughts of people around me. And so, like, at no point did I actually register this as a problem. So people always ask me that. They're like, was it scary? And now that I'm aware, now that I have medication, but I still have symptoms occasionally, I think there's more of a fright now for me. Like I definitely have more confusion, more emotions surrounding my symptoms because I'm more self-aware now. That's just one of the unfortunate things with being someone who's medicated is when I wasn't medicated, I didn't recognize that anything was wrong with me. I'm so grateful to only have symptoms occasionally, but it does come with, this self-awareness of, hey, I have schizophrenia. Occasionally I do still have breakthrough symptoms, and that's really scary, and that's something that I didn't experience early on because of the delusion.
Right. So we're talking about insight, right?
Yeah, absolutely.
If you're first experiencing episodes, this is all new to you, sometimes there's a disconnect with reality where it feels natural to you because there's a lack of insight. And sometimes you don't even realize, it sounds like, that what you're experiencing is abnormal, or at least a condition.
Yeah.
Right.
Well, and you got to remember too, I was a caregiver for someone with schizophrenia.
Mm-hmm.
I know what schizophrenia looks like, maybe better than most people, even at a young age. And even with the knowledge and education I had around it, it was still difficult for me to identify that in myself.
Absolutely. So what do you think helped, in your experience, kind of bridge that gap back to reality, or to being receptive to help?
Like Carlos, it was community. It was my wife. It was my mom. I was very lucky that the people around me were concerned. And unfortunately, it did take me a while to reach out. I struggled for several years trying to self-medicate through addiction. And so I went undiagnosed for a couple of years. And the only reason I finally reached out was because I knew that I was unwell, but I didn't recognize it was schizophrenia. I just could tell that, like, I wasn't able to keep up with everyone else. I couldn't hold a job. I had to drop out of school. I literally felt like I couldn't get through a day without some sort of substance. And so That's why I reached out, not because I thought I was mentally ill. And little did I know that my mom and my wife during that time had been preparing a doctor, a psychiatrist, peer support groups, other resources, so that when I did reach out, I had all of that access. And my mom, who unfortunately went very long undiagnosed or misdiagnosed, she kind of set up a very quick process for me, because once she was formally diagnosed and then I showed symptoms, it was very easy for me to get a diagnosis, get treatment, get medication, because I had, any psychiatrist could look at my family history and see that I had a genetic predisposition for it because of my mom. So, her struggle through her mental health journey actually made it so that I could get very quick and early access.
What a wonderful way to create meaning, right? From such a difficult experience for your mom. And like you said, they paved the road for you, which is huge, as we know. We also know, because you touched on substance use and self-medicating, I think that's sometimes a convoluted topic, because a lot of people will assume, oh, that person's just having symptoms because they're on drugs. But in the mental health world, we know that it's usually, it's not just the chicken and the egg. We know oftentimes an organic condition leads to substance abuse, because for whatever, it's sometimes the first line of defense people learn in terms of managing their symptoms, right?
Yeah.
If they're not familiar with the mental health world.
For sure. And if someone is, in times where I did have moments of clarity, there was a stigma that I had around mental illness, especially living in a small rural area.
Mm-hmm.
There's a stigma around mental illness that I didn't want to be labeled as someone with a mental illness. Just the same way that there's a stigma around medication. I didn't want to be that 19-year-old kid on medication.
Mm-hmm.
So even if I had brief moments of clarity in that period, I wouldn't reach out, because I was afraid of labels. I was afraid of people judging me for, I had saw how people treated my mom growing up, and kids weren't allowed to come over to our house because my mom had mental illness. And the Midwest, small rural areas all over the country have this issue too. I know Carlos had talked about it in his community, and this is a problem in a lot of different, communities and groups and areas where people don't want to talk about it.
Well, Kody, how did you navigate that? Like, how did you learn to accept the diagnosis, and how did you learn to communicate that to others in a way that felt okay for you or tolerable?
I think one of the things that it took a long time, but peer support was a big thing. So Carlos had mentioned peer support. My very first example of sharing my story was going to a local peer support group and being confident enough to tell everyone else about, my daily life. And I didn't even do that on the first time. The first couple times I went and I didn't say anything because I was too nervous. Once I heard stories from other people, I started seeing similarities, and that gave me the confidence to tell my own story. When I started telling my story, I found that there's a couple different ways that I do it. One is I am a storyteller, but I also find that comedy is a way that I cope, and it's a way that I am able to tell my story and have it not be so draining. And so I started tying in comedy to some of my content, and that allowed me to reach even more people who were afraid to talk about schizophrenia, and they didn't want to open that door. Comedy, I think, opened the door so that people could peek their head in and stick around and actually learn a lot.
Huge, right? Because it breaks the ice. Again, the stigma, right? Having a way to kind of reduce the tension in the room. And sometimes that's by laughing at ourselves a little bit, and kind of learning how to relate to other people. And that's huge. That's a wonderful coping skill. And I appreciate you sharing that. And it's just something I'm personally very curious about, because I work with so many clients. And that's one of the biggest challenges with even asking for mental health help is, how are people going to see me? Or if I take medication, what does that mean about me? And I don't want to be labeled, and I don't want to be that person, and so there's just so much of that work that has to be done around. And then how do you communicate to other people, or even in relationships and dating? Like, how do you bring it up? When do you bring it up? What does that look like? and I know it's a little bit different for everybody, but that's usually one of the biggest hurdles with being consistent with treatment. Right?
Yeah. Well, me and Carlos, when he came on my podcast, had an amazing conversation about goals and setting goals. And so, like with Carlos doing all the amazing things he's doing, I don't think I could go back to school. I don't have that sort of focus in my life. But he talked about setting really small goals and moving from there. Like when we both talked about being very early on in our journey. And at one point, my only goal was to get out of bed that day, and starting with very small goals and moving to things like, becoming a board certified nurse practitioner and going to law school, because that wasn't enough for Carlos. He had he had to keep going back. So, but I found that, I find that like to be a huge thing for me. And now after that conversation, I recommend it to people all the time.
Absolutely. Find ways to challenge yourself, right? Meaningful ways. And because the question, Carlos, now that you're in this, professional position, you have been for a while now, like how do you navigate clients through these waters when, from like early diagnosis through treatment? Like what do those conversations typically look like? How does a clinician support somebody who's experiencing schizophrenia and engaging in treatment?
Those are some great questions. And I think it boils back down to some themes we've talked about, which are education, and empathy and advocacy. I think you mentioned humility in the beginning there as well. And it's important, especially as a professional serving the population, to approach this, this caring for people with humility, understanding that, you may be a technical expert, but they're the experts by their own lived experience, and the caregivers are as well, because they live with the patient, the individual, and see them much more often. So, approaching with some humility, kind of viewing this as a partnership where you're not just, I'm here to tell you what to do, but rather let's look at this together. How can I help you achieve your goals, and perhaps how can medical care or treatment align with that? So viewing care in a manner that's holistic, that sees the person first and sees what their values and goals and aspirations are. And, it's also, we're also in positions of privilege. So when we can advocate for other people using our platforms, using our voice and so forth, that's important as well. But I think if that's kind of has been my philosophy. I'm also in somewhat of a unique position that I have the lived experience as well. And I do find that does enrich my practice, because, sometimes patients, especially when they're in the early phases of the illness, they may not fully appreciate it. But when I share my personal experience, and to caregivers, they really kind of light up, and they really see the value in that, because they know how important it is for their loved ones, often their sons or daughters or so forth, to engage with other people with lived experience. It's the power of peer support, once more. And so that's a little bit about how I kind of approach it. But again, we can always be continuing to educate ourselves. We can always try to lend a empathetic and listening ear, and when we can, try to fight for others as well.
I appreciate that. So can't be emphasized enough, right? Not just support in-house clinic, but community support, peer support, right? Having that village. And I think that's oftentimes a missing piece in treatment. You come in to see the psychiatrist or the practitioner every 3 months, for your injections or your medication, and then they don't come around again to the clinic, and sometimes they don't have anything on the outside. They have very difficult home lives. Clients, come from all walks of life, but having that support is huge. That sounds like.
Well, they say it takes a village to raise a kid. It takes that same village to heal that teenager's mind when they're struggling. And, often where I get my clinical hat now, we're often the last person to really hear about what's happening, what's going on. It's really friends and families that are often in the first line. So, listening to them, and when you can, educating them so they can pick up on the warning signs or the red flags, and urge the person to consider care. I mean, that was the case with me in my recovery, where it was my friends that had known me for a long time and saw the changes in college, and my family who saw the changes at home, that were able to then inform the providers, this is what's really happening. Because I also struggled with that kind of lack of self-awareness at first. it's kind of a double-edged sword. It can lead to, trouble or ambivalence or antagonism toward getting care, but it's also kind of a form of grace, because when you truly appreciate what is happening, it's quite terrifying. And like what Kody said, it was earlier on in my recovery when I still had occasional setbacks that I was like really the most afraid, because I didn't want to go back to where I was before. But fortunately for me and for many others, if you stick with it, with the recovery, with one's goals, with the medication, with the kind of holistic approach to it, also peer support, community therapy, the whole toolkit, I think it does get better. I really do think, it can get a little easier and it can get better. So, it's important for us also to convey that kind of hope and optimism to people, especially people struggling early on, where they may not feel that there is a future where things can get better.
Absolute hope is so important. Yep. Right. And I really appreciate what you said about, on the practitioner side, learning how to elicit support and information from collaterals, right? Be that friends, be that family, look at the systems, right? Find out who has the best, connections and perspective, and who can keep you informed, right? And how you can maintain those flows of information for the client to keep them on track, help them, even from afar. Right. It's important. Yep. And that, it's important to remember as practitioners, intake, right? That we make sure that we're getting those consents in place, because if somebody's coming in, be that through a hospital discharge or just families bringing them in because they're experiencing symptoms for the first time, maybe they're a little disoriented or paranoid or whatever it may be, sometimes that's your little window of opportunity to get consent, right? From family.
Yep.
And because something may happen between intake and the next time you see that client. And if you don't have the consent on file, your hands are kind of tied. The client's maybe not answering their phone, voicemail's full. Oftentimes those things are, pretty common when somebody's going through psychosis. They just kind of, phone goes by the wayside. They can't really reach them. And then next thing you know, you don't hear from them again until they're coming out of the hospital. Right.
That was true for me in my story, where it wasn't until I consented to have my family be part of the conversation that we were able to treat me in the most effective way possible. This is a developmental condition, so I think treating the family or incorporating the family when possible, when appropriate, should be the norm. I know it's not often. It can be challenging, because sometimes it can cut both ways with family. They can be support, but they could also be a source of challenge for people. And then, of course, there's the legal regime we operate in, which people are considered adults after 18, and that can pose a barrier as well. But I guess in my story, it wasn't until we were able to have honest conversations by getting the perspective of family members at the clinical assessment that we were able to really move forward.
Yeah. How do you suppose that we can best equip family to support their loved ones who are going through something like schizophrenia? Like, in your experience, like in either of your experiences, how can we as practitioners kind of bring that support to the family? How can we firm up their foundation, their education? What options do we have?
I would think one thing that I would have loved to see more of would be honest communication, even if it's not what the patient or the family wants to hear. For example, I was never told that when I started medication, I would still have breakthrough symptoms. And so when I started medication, my thought process is, okay, I'm finally doing it, but at least it'll be a cure-all. It'll fix everything. And then when it didn't, I was extremely disappointed and I quit my meds. And that's, from what I hear, very common for patients with schizophrenia or psychosis. And so equipping both the patient and caregivers with honest, like, this is going to be work. Here are things to look out for. Here are common things that people with schizophrenia face. Like the two things that I've dealt with, I know most other schizophrenia advocates have dealt with, which was, quitting my meds because they didn't work as well as I had hoped. And then when my meds started working really well, I quit because I didn't think I needed them anymore, which are both really common things I hear from peers and advocates. And if it's that common, let parents know, like, this is something that we might have to be aware of that could happen in the future. Just examples like that. Like, there are things that we see so commonly. And I know that practitioners are seeing it because I see it as an advocate just talking to other advocates and patients. So I know that there's really common patterns we're seeing that I think if we were honest, it might help prevent some of these issues we see moving forward.
Absolutely. Thank you, Kody. You read my mind. I was just thinking as you were talking about that yes, one of the biggest problems I see is that when the symptoms do start to become mitigated, that clients will be like, oh, I'm better now. I don't need the medication. And then next thing you know, and it's tricky because some medication has higher half-life than others, right, Carlos? So something like Seroquel may be in the system longer than another. And especially if you're on injections, yeah, you might not have another episode, even if we're not talking about specifically the medication, but just episodes in general, right? Just because somebody has a condition doesn't mean that without medication, they're going to have symptoms chronically, right? It can be seasonal, or the episodes can be every 6 months, maybe once a year, that the major episodes, like even with bipolar and mania. So it's not always the same for everybody. And so that's why we say it's a messy science, right? And so understanding, to your point, Kody, how we can educate family and clients ahead of time about, so these are some of the hurdles we see oftentimes, right? These are the reasons that sometimes there's trouble making progress, or I've even seen with clients sometimes medications, they may decide, like you said, the side effects, it makes them too groggy, can't think straight, libido issues. I mean, there's a number of things that can become intolerable. Yeah.
And I think that's another thing where I also experience frustration with that. If it had been communicated with me up front, I think we're so afraid of turning people away from meds that we're afraid to be honest about them. And I don't think that's the right solution. And so I think we need to be like, hey, here are some things to look out for, but if it works out and your medication works the way it's supposed to, you'll have clarity. You'll be able to, you'll have a life that you didn't think you would get to have. So it's still more pro than con. And I think we're painting it too much of a, glamorous picture. We're doing what I try not to do on social media, which is I call Instagram filter it. I feel like we're Instagram filtering the future for people.
Yeah.
And I think we need to put a real image on hey, there will be stuff that makes this difficult. Here are some things to look out for, but in return, you'll be able to, function day to day. You'll be able to potentially go back to work and find success, go back to school, all of these things that you wouldn't have without the medication.
Huge. And I love that you touch on the fact that, yes, we need to be direct. We need to be real. We need to be authentic with clients about and to Carlos, like you said, balance that with empathy. Because I've seen both sides of that. I've seen some psychiatrists who are just very matter of fact and stern, and this is the way it is. Either you need to do this, or I'm not going to treat you at all, or you're just being non-compliant, as opposed to saying this is going to be hard. This is going to be an uphill battle. This is going to be messy. It's going to be trial and error. It's going to take months to even see if these medications work, right? And then if they're not, then we might have to add a second or third, or we might have to switch stuff out, and you'll have to start all over with new side effects. Having those conversations, like you said, Kody, there is the fear, and I've had this myself, about, I don't want to scare clients away, or maybe they're coming in and they're, not just having psychosis, but they're depressed too. I don't want to, tell them, oh, this medication might make you more suicidal. Not that it's for me to say, because I'm not a doctor, but having those conversations and in terms of what they expect, sometimes it is, takes a bit of finesse, but I think empathy and being direct is a great approach, to be sure. We kind of just touched on that. I'm nurse practitioner, Carlos. I mean, for those who aren't familiar with the language, that's not your average nurse. Nurse practitioner can prescribe. Nurse practitioners function like psychiatrists, right, in the mental health world. And much like you'd see a PA, right, in the primary setting, nurse practitioners in psychiatric settings, they prescribe, they diagnose, they carry a lot of that charge, a lot of that weight and responsibility. And it's a very powerful position to be in. And your experience, Carlos, like when it comes to the medication conversations, like what does that look like from a practitioner and client standpoint? Like what can one expect for instance, if somebody's listening and they've never been through the process, like if they walk into a clinic, like what can they expect?
Well, I mean, you've raised some great points, and Kody has provided a lot of insight. Um, uh, it's speaking to the clinicians now, we get anywhere from 15 to minutes to an hour. It's a lot to try to educate and orient someone to a potential diagnosis and what this might mean moving forward. So that's why I think it's important, and it bears repeating again, that we have to offer evidence-based sources of information and education. As mentioned earlier, there's the Hope for Schizophrenia website, the Unseen and Unheard podcast. There's also organizations like NAMI, the National Alliance on Mental Illness, which are a great source of information, education about these conditions. There's also, which was instrumental in my recovery, and which I refer to my clients as a clinician, attending their services like support groups and education programs, so you can continue to learn not just from providers but from people who have lived experience, because we have a unique kind of insight that comes from navigating these challenges. So it's almost an impossible task to really do all that within the first couple of meetings with someone. So it's really a process that takes time, and it takes, again, that community approach and learning from peers and people with lived experience, as well as clinicians and professionals. And I think it's really important what Kody was saying about painting a realistic picture. We are examples of people that have been able to be successful and done well, but that doesn't necessarily mean that it's been easy. I'm sure our lives are harder with this illness than without it, but it doesn't mean it's still not possible or not worth pursuing. For us, I think we realized it's kind of a no-brainer when you realize what the alternatives are, of ending up incarcerated or homeless or estranged from people that you love. You take the medication because you know that you don't have much, it's really the best option at giving you a fighting chance. But even then, it's by no measures an assurance. And, what I tell people is the medication is necessary, but it's often insufficient. It's often not enough. You need to lay that foundation and then build the house of recovery on top of that with your whole toolbox, with your education, psychoeducation, with your therapy, with your peer support, with your advocacy, with your supportive work in school. Because, the big picture recovery, what people really want, not just staying out of hospitals and staying stable, that takes months and years. And this is something also that, because of that time frame, you got to give yourself a little patience and a little grace to go through that messy science, that trial and error process of getting the right medication, that trial and error process of finding the right therapist, and so forth and so on. So these are kind of some of the insights I'll share with my patients and clients. But again, it bears repeating that it's a process that takes time, and the more you kind of scaffold in different information from different sources, the better it could be for the person who's going through this journey for the first time. And like myself, I had no awareness of what mental health was. I never talked about it at the dinner table. I never, and then you kind of get kind of struck by a bolt of lightning, so to speak, and you suddenly have to almost become a little bit of an expert, even if you don't have the credentials yet at the end of the name. You got to kind of arm yourself with knowledge and learn, what you have to do to manage this condition, because it takes work to live with it and manage it long term.
Yeah, self-preservation. Absolutely.
Yeah.
Yeah, it's no longer a theory. It's your life.
Yep.
Yeah.
That's what I tell people. I don't have the luxury of wondering about bird migratory patterns or geological formations. Like, I had to learn a lot about mental health, because this was it. This was the challenge ahead of me, and I knew this was the most important thing I had to control or manage, so that I could have the best quality of life I wanted. So, I went so far as to become an expert in it as a clinician, as an advocate, as a researcher. But I think also that's not uncommon. A lot of people have mental health conditions or adversities, and they see themselves, I want to take what I've learned from this, and I want to help others. Kind of the wounded healer, so to speak, concept, or become an advocate like Kody and become an educator of people and have an impact at a scale that you can't even have on a one-to-one with people, by using social media, other avenues, which is incredible. So
it's huge that we even, to live in a world like today where you can create your own platform to educate others. That's why I created this podcast. Not just because I need something else to do, but because I don't think this knowledge should be reserved. These conversations should be reserved just for the therapy room on a one-to-one, right? Because there's too many people out there who need to have these conversations, who need to be in the know, right? We need to be raising awareness on a larger scale. And I think every body or every person should have some way that they are contributing to society in a meaningful way through their lived experience, and especially in the mental health realm. And so that's why I just love the work you both are doing. Just excited to see where it goes. I'm curious how you guys came to know each other. Was it through your podcast, Kody, or what happened? How did you guys get into the same room?
I like to joke that because of my very large social media following, I'm friends with every schizophrenic person on the planet now. And so like we just, it was a lot of the same. I heard his name at conferences. I'm sure he heard about me through social media and stuff. And it just like, I don't know where we first got to meet. The podcast was the first time I think we really got to connect, have a conversation, but we were aware of each other before that. So it's just been one of those things where I've been very lucky in this journey of like doing social media and doing the podcast that I've got to work with people like Carlos. On the Unseen and Unheard podcast, I even got to interview my mom for the last episode and talk about not just her journey through schizoaffective disorder, but what it was like having to watch her son go through a similar diagnosis. And so I'm just very lucky and fortunate to have this platform and have this ability to kind of be a voice for the voiceless, because I know there will be a lot of people with schizophrenia who will never be at a point where they can share their story. Even though we only make up 1% of the population, I think I saw a study that said we make up almost 20% of the homelessness rate. And
that's
so
huge.
And that's not, there's also so many people incarcerated, so many people struggling with addiction. And so me and Carlos are very lucky, but I feel like we could be better. Like we shouldn't be this lucky. This should be a more of a norm. If people had early intervention, access to treatment and medication, this could be more of a thing where I'm meeting more and more people living full and functional lives with schizophrenia. But every day I'm seeing more and more people coming out, sharing their story. And for that, I'm so grateful.
Well said, Kody. Well said. Right. Should be the norm. Right. Or say it another way. You shouldn't have to be the exception.
Absolutely. Yeah.
Right. And that's why I love what you're doing. You're raising hope and awareness, and you're showing that you can have a quality, meaningful life, a full life, despite having a diagnosis like schizophrenia. And I love even the way you phrase it, because I can tell you're an advocate when you say I have schizophrenia, as opposed to saying I am schizophrenic. Huge difference, right? It doesn't define you. Absolutely. Absolutely. And Carlos, just curious. So nurse practitioner to law student, and now you're prepping for your bar exam. Is there a connection between your pursuit of your law degree and the work you're doing now? Does it translate?
Absolutely. I think, I have the lived experience as being a patient and navigating the healthcare system and seeing all the ways that it still has to improve. For example, primary care and behavioral health care don't often coordinate very well. And when you live with an illness like schizophrenia, you're not, passing away early or struggling with more health issues necessarily because of psychosis, but because of preventable chronic primary care health conditions like heart disease or other kind of conditions that are treatable and preventable. But again, because there's often no coordination between primary care and behavioral health, it's left to the patient and the caregivers to coordinate that and advocate for the care they need. And that's often a tall order for anyone, let alone someone struggling with this illness. So I think I have the perspective of navigating the system both as a patient and as a clinician. And my hope is with the law and policy education, it'll open doors that allow me to to continue to push for mental health care reform and to build a system, like Kody said, where the norm and the expectation is people get early intervention, people get support in their community and not in institutions, where people have access to a variety of treatments so they can find out what works for them and so forth. Because, we have to recognize our luck and privilege. Often, as is the case with this illness, again, you don't pull yourself up by the bootstraps. You need people to step up for you. And so many people may not have that support in place, or they may not feel that they're at a point in the recovery where they feel comfortable sharing, because they might feel they might face very real discrimination or stigma. But it's important to recognize that at the end of the day, this is still a condition that people can and should be given the opportunity to recover from, and it's unacceptable that people are not often afforded the opportunities we've been.
Wow. And love the advocacy. I love the mission you both are on, and it's been an honor and a privilege to have you on and to educate our listeners. And it's just, I really appreciate it. So thank you so much. And love to see the work you're doing. Now I'll be trailing you guys online to see, the wonderful work, and anything I can do to support you, just let me know. And you're always welcome back on the podcast. Just tap my shoulder. So appreciate it.
Awesome. Thank you so much for having us, Patrick.
Oh, my honor.
Yes, thank you, Patrick.
Privilege. Yes. Thank you so much, guys. You have a great rest of your week, okay? All right. Thank you.
Thank you.
Hey, if you're getting value from this content and you haven't done so already, be sure to like and subscribe to the YouTube channel and podcast, and be sure to subscribe to the MHT newsletter. That way you don't miss out on any new content as it's released. Links in the description.